Okay, we are here with Melanie Longmore. She is a nurse with Labor and Delivery at LDS Hospital. And we are talking about a topic that has gotten Michelle and I both a little bit baby hungry, just remembering these moments and talking about it. We are talking about skin-to-skin care, the moments right after your baby is born. And I feel like this wasn't really a big thing for my first 6 years ago. When has this kind of come into the forefront of hospital?
I would say it's about 5 years ago that it started to become in vogue. They started to see the importance of, right after baby's born, putting her right or him right up against your chest. There's a lot of advantages, both short-term and long-term.
And we're talking before the measurements are done, the weight's done, like
yes.
Right after you clip the umbilical cord,
yes.
Baby goes right on the chest.
Yep, absolutely. As soon as possible, and for as long as possible, about an hour. And they call it the sacred hour, and at first I thought, okay, why is it being called the sacred hour? It's because it's a once-in-a-lifetime opportunity. You'll never get this back, and the benefits are just phenomenal. They're out of this world.
Well, I love this. It's actually giving me goosebumps thinking about the sacred hour, and you're talking about these benefits, and you said there are even some short-term immediate benefits that can come. Let's talk about some of those.
Okay, so some of them are temperature regulation, the baby's blood sugar, their ability to breastfeed. All of that is promoted by keeping baby right there on your chest. There's 9 documented steps or stages that the baby goes through as they lay on the chest for that first hour. They can actually crawl to the breast and nurse right then and there in that first hour,
well, and that
which is
actually
incredible.
happened with my second. He actually, and he was my best nurser, and I kind of contribute it to that and say, oh, well, maybe it was because he got to learn within 30 seconds of being born.
Well, and I love how, you know, the weight of the baby's not going to change, the height, like those things can wait.
Yes.
And that moment, right, you know, right after that, you can just have them as opposed to having the nurses take them away, and that's such a beautiful moment that you truly like will never get back, and it's so amazing that they're actually promoting it and that there's benefits from this.
Yes.
Well, and luckily for those who maybe have complications with the baby, my first, the cord was wrapped around his neck. What should they do if the baby needs to be treated for something right away and you can't get them in the first 30 seconds?
Right. So obviously the baby needs to be stable in order to do this. So if baby has to be whisked away for a little while, there still are benefits of doing skin to skin shortly thereafter, you know. And even when you go home, there's benefits of skin to skin contact. The mom has hormones that she releases that helps her to handle the stress of being a new mom. The baby also releases hormones that will help the baby to adapt from being a fetus to a newborn. That's a stressful time for those babies, and they need all the help they can get.
Well, if I ever have a baby again.
Well, and I love that you said even with C-section, so that's good to know. So if you're having C-section, you're fine. Well, more information about this and about LDS Hospital is available at ldshospital.org, and there is their number up there as well. Melanie, thank you for coming in and making us a little,
welcome.
or maybe curse you for making us a little baby hungry.